Good day, everyone. Doc Mika here, and this is Module 9, which will cap off the coverage of the second lecture exam, which I will be posting by early next week, right? I know I'm going off schedule because I recorded this module quite a bit late, but I am also giving some allowance to some of you who have personally messaged me to about their own what do you call this, personal difficulties right now academically. So I'm stretching the schedule for that, and I hope that um, with everything that we see right now, everything that's happening with ourselves, with our family, and with everything around us. I hope that every one of you would keep strong, keep your family close to you. You always need your support system. And I hope that you will and your family will be healthy through it, through this, this pandemic, which seems to not end, all right, for the Philippines. So I wish you all good health and always take time for yourself. Wag niyo kalimutan na ang ACADS, pwede niyong balikan yan. Alright? Hindi naman to race na kailangan yung matapos at a certain time. We all have those pressures wherever they may come from to finish, to pass and all that. And I hope that you will find it in yourself to focus on yourself, your physical, emotional, and mental health as we go through this. It has been more than a year. I understand, and we cannot directly affect what's happening in the society. We could be all disciplined and all that, but we're not in charge. But what we can directly affect is ourselves and our families. So focus on that. I There's a handful already who dropped to focus on themselves, and they always apologize, and they always say there's no need to apologize for it. You're not failing anyone. You're focusing on yourself, and that in itself is a feat. You have to be proud of yourself when you prioritize things other than ACADS. All right. I apologize if I'm starting the module with this, but I feel that each one of you deserves uh, time. It's very hard to focus oneself. Our circumstances are all different, so it is very hard to enforce requirements right now, just for the sake of getting a passing grade. Easily, I could all give you a tres, easily. So, whatever I may see in your exams and all that, but we are still an academic, what do you call this? Ang pamantayan pa rin sa academe ay exams and quizzes, and right now, I don't think they even figured that out yet. So I just want you guys to not worry so much about ACADS, especially this online stuff, which I don't know if you will ever stop doing online classes up to next semester because the government's going to crap. But that's why, like ko sinasabi, ang ACADS makakapaghintay, but when you put yourself at the bottom of your priority, yung effect nun would be felt not just by you but everyone around you, and would affect all aspects of your life. So focus on yourself, focus on your family, your parents, your siblings, your children, of course, your partners. Yun naman ang nagmamatter. Alright? Ang ACADS, ang college, pwedeng balikan yan. Wala namang humahabol sa inyo. All right. And I understand some of you actually chose to work, to push yourself to napagsabayan yan. I applaud you. I I always put myself in your shoes. Um, uh, like this online thing when I always imagined myself when I was in college, I wouldn't be able to do online stuff because nagkaroon lang naman ako ng access sa laptop na sarili by nung graduating na ako because I needed to write my thesis, you know? So before noon, I was relying on internet cafes, friends who have their own laptops who would let them, uh, they would let me borrow it. So I know for sure I would be one of those students who would just drop and work, So you understand, I hate to enforce a lot of requirements as of this time because it's very hard, even for me. So right now, okay, I'll start with a module. This is quite short. I will simply be enumerating and discussing the common wound medications that we utilize in small and large animal surgeries. And even if we are not enforcing like a surgical procedure, right? We still use these wound medications, especially for wounds that we employ secondary intention healing. All right, let's begin. So the number one wound medication that you would be introduced to when you go into clinics or when you're actually doing your pharmacology subject would be the antimicrobials, right? The goal for the use of antimicrobials would be to eliminate or reduce the the microflora on the wound, which can cause tissue damage and concurrent infection, right? And antimicrobials can be in different preparations, right? Number one would be the topical antimicrobials and you have systemic ones. Anong pinagkaiba? Basically, the route of administration. Topical antimicrobials would be topical, but they would be administered topically on top of the wound, around the wound, while systemic antibiotics are the ones we administer through the IV or through parenteral or through subcutaneous routes, wherein it will reach the systemic blood circulation, right? Now, the topical antimicrobials, this is preferred for open wounds, quite superficial, superficial aberrations, small lacerations, that would do, right? And this is ideally applied within 1 to 3 hours of contamination to prevent infection. Now, the use of antimicrobials does not preclude or remove the need for the cleaning, the shaving, the debridement, all those methods that we have discussed before. Because kahit ambakan mo yan ng antimicrobials, right? Kapag hindi mo nilinis ang sugat, kapag hindi mo dinebride yung necrotic tissue, your antimicrobials will simply act on the microorganisms which are contaminating it. It will not debride your necrotic tissue. All right. This will not this will not prevent, kumbaga, the tissue damage that is brought about by necrosis and by other foreign debris, which are not affected by antimicrobials. Right? Kapag naman ang wound is quite deep, ang na-reach na soft tissue level, when it is heavily contaminated, when it is beyond the golden hour, when it was brought to you, it is always advised that you compound the topical antimicrobials with systemic ones. All right. Now, the route that you're gonna take would depend on the patient, basically. Kapag ang patient ay mahirap hawakan, kapag aggressive, you needed to sedate to examine the wound, then it will be hard for an owner or even for your hospital staff to administer the drug. For example, if it's an oral drug, na twice a day, di ba? So you would have to think, sasweruhan ba tong pusa na to? Kapag swero, might as well give your antibiotics IV. Kapag hindi naman, kapag kapag ipapauwi nyo na rin naman siya sa owner ng bahala, pero medyo fira lang cat, then might as well go for a long duration antibiotic, a subcutaneous injection like Convenia or cefavocin. All right, now, once infection is established, once the process of infection, bacterial multiplication has been established on the wound, pus formation in the wound cannot be stopped anymore by any type of microbial therapy. Pus will develop as part, again, as part of your wound healing process. The way that the antimicrobials would work is to prevent it from spreading so much and slowing that infection down. Now, this is simply a table to direct you to ano yung makikita mo sa patient and to the level of bacterial load, all right, of the wound. So you could start with contamination, and as the bacterial load increases or as the bacteria multiplies and infection occurs, that is the flow of your table from contamination, colonization, critical colonization, local to systemic infection. And you would, it's commonsensical as well that the signs would also be worsening as the bacterial load will also increase. Okay, this is just this is quite a good table for light reading. Basically, that's how I term it, for light reading, para makita nyo yung actual na signs. All right. Now, this is not like a stepwise thing. What do you mean? It could overlap. You know, contamination, if it's so heavy, it could go directly to critical colonization and then to local infection. Hindi yan dahan-dahan nangyayari. Depends on the depth of the wound, depends on the level of the initial level of contamination of that wound. Right? Now, again, as I have said, hindi naman antibiotic ang magic pill na magpapagaling sa sugat, right? You always have to remember the processes that we have discussed in management of wounds. We have to protect the wound as soon as we see it. We have to prepare the skin, the hair clipping, the skin disinfection, the wound lavage, which is, it mechanically removes those gross and microscopic debris on that wound. Again, you could use a variety of compounds for that. And wound debridement, right? Yung presence ng wound debris, the increasing microbial contamination will just make things worse. It would prolong inflammation, impair healing, and lead to systemic infection if we do not debride, right? Now, the limitations. What are the limitations of your antimicrobials? As I've said, it's not a magic pill, and it's usually used in combination with other wound management methods. Right? Number one, the wound's limited blood supply. Okay? When we utilize systemic antibiotics, wherein the level of antibiotic would be high in the blood, and we know that the wound has a limited blood supply. Okay, the vascularity has been damaged, it has been bleeding, it has lost a direct blood supply to that wound. Kaya ang isang process ng repair phase would be angiogenesis. Nagfo-form pa lang yung bagong blood vessels toward that part of the skin that was damaged. So if you use systemic antibiotics lang, and the wound has still not reached the level of angiogenesis, hindi makakarating yung gamot dun sa wound because walang pupuntahan, walang blood supply. Nagfo-form pa lang. That's why in those stages of wound healing, you rely on your topical antimicrobials to address the bacterial contamination on the wound itself. And then you have systemic antibiotics addressing any local or systemic infection that has been spreading from the wound towards the rest of the body. Right? Number two, wound debris and bioburden. Right? Ang dose na gagamitin mo sa gamot, of course, you cannot actually count, basically, the number of bacteria, colony-forming units in a wound. All right? Your culture can give you an idea. Your culture can give you the names of the bacteria, right? But of course, with higher bioburden, you would require as well either a higher dose of your antibiotic or a longer duration of your antibiotic, and this would depend on your on every patient's condition, right? Number three, correct concentration of antibiotic and antiseptics. Right? I've nadaanan ko to before. I think this would also, I think I've discussed in pharma as well. Antibiotics would usually have a range. Remember? like cephalexin would always be like 22 mg per kg, but the classic range from Merck is around 15 to 30. uh, those ranges. And you can play around those ranges. Kapag you anticipate, this is connected with bioburden as well. If you anticipate the bioburden or the number of bacterial contamination on that wound is quite high, the patient was not presented to you within the golden hour of contamination. Again, how many hours is that? I think I discussed that in either module 7 or 8, right? So you have to address that as well. Will you use the high level of the high dose of antibiotic? Will you go for the middle range, or we go for a low dose? Okay, that is where your medical judgment would be tested as well. There's no rule for it. Basically, we always say there's a definite range na gagamitin natin, like 15 mg per kg, 13.75 for amoxicillin clavulanic acid, um, you know, all that's in the literature. But of course, we can go for other points of the range depending on your patient, right? And then antiseptic inhibition by organic matter. This is we know that some of the antiseptics that we use would be inactivated by organic matter, like soil, like not blood, yeah, blood, dust, and all that. Mud, especially if your patient, like for example, this is very common. A stray dog was hit by a car, left by the side of the road, picked up by a rescuer, picked up by a good Samaritan, brought to you. They don't know anything about the patient. So looking at the patient, if there's a lot of debris, sometimes there's wood, leaves, branches, soil on that big open wound, then you have to think what antiseptic that you should use. And the importance of cleaning, skin preparation, hair clipping. This is why those methods are so important for your antiseptics and your antimicrobials to work, because a lot of those are inactivated by organic matter. If there's a film or a layer of organic matter that you failed to clean, that you failed to debride, that you failed to remove, kahit anong tambak mo ng antiseptic and antibiotic, those just wouldn't work, right? So those are just the limitations. These would help you how to decide on what to use and how to use them, right? Now, the number one, always, even for humans, even for us, choice kapag merong sugat, anong cream, anong ointment, right? Would always be a triple antibiotic. You have the bacitracin, neomycin, polymyxin mix. When you go into a clinic, when you go into just a normal like grocery, you would see a lot of this over the counter or just on the shelf waiting for you to pick it up, right? And this combination, right, is good because not only it is broad spectrum in nature, right? But it has been found to be, basically, if you do not know yet what are the contaminants of the wound, then this is your option. However, it has been found that it is not working as well for the Pseudomonas bacterial species, right? And we expect the Pseudomonas to be the one for deep soft tissue inclusions of the wound, right? Some notes, I would not be going into like MOA, MOA dose and all that, because I think that is discussed in a separate subject because these are drugs, all right? I don't know if you're still doing, what do you call this? The drug formulary. I forgot what you call that, where you list the drugs and then this is an activity in pharma. I forgot what it's called. It's like drug something. Never mind. Wherein you list the drug, you list the dose, the MOA, the indication, contraindication, precautions, concentrations. I'm not gonna go into that, but I'm just gonna point out some aspects of the drug that affects wound healing, basically. So zinc bacitracin is quite a common inclusion of wound or skin ointments because it enhances the process of wound epithelialization, but it can retard wound contraction, right? That's why you only prescribe this for like 7 to 14 days kapag medyo bukas pa yung wound. Kapag nagsasara na, no need to put it in, right? It is poorly absorbed, which makes systemic toxicosis rare. So it's quite good, right? Doon lang siya nagsistay locally sa wound na yon, right? And when it is used systemically, right? That's why these drugs are just used topically. It's because when they are administered systemically, they can do damage to the kidneys, ears, and the nervous system. That's why they're called nephrotoxic, autotoxic, and neurotoxic, right? Again, dose dependent. Silver sulfadiazine is the drug of choice, even for us, for burn wounds, right? It is effective against most gram-positive, gram-negative bacteria, and even fungi. And what it does is that, what do you call this? Basically, it forms a barrier. Number one, that barrier is antimicrobial in nature. That barrier can penetrate necrotic tissue if you do not see agad any signs of necrosis, but the process is ongoing and it will form. So it can penetrate that, and it can also enhance wound epithelialization, right? And silver sulfadiazine is commonly combined with aloe vera, since silver sulfadiazine, as it is, has cytotoxic and wound retardant effects. Right? It's also hydrophilic, so medyo, even if it's a cream, it's so easily spread. Right? Have I used this? Yes, in burn wounds. Very common when, okay, you do surgery, your patient's temperature is going down, they are becoming hypothermic, and you need to provide a heat source. Anong ginagawa ng surgery students? They get their gloves, they fill the gloves with hot, okay? Hot, direct from the dispenser, hot water, right? And then, ididikit sa katawan ng aso. Anong nangyayari? This is hot water, boiling hot. Okay? Even if you have the gloves, which are basically, it will just absorb the warmth, they tend to burn the skin of the patient. Right? That's why always remember this when you go back to school and you do your surgical procedures. Do not directly place the gloves that is filled with hot water to the skin of your patients. Right? A lot of them already had we call this experience burn wounds, contact burn wounds because of that. So we had to address it as well. Some of them, most of them are owned by the students, so madaling i-manage. But there's like one or two na hiniram yung pasyente, then pagbalik meron siyang burn wound, parang may pasa siya sa tiyan. So we want to avoid that. We're just spaying. Ini-spay lang natin yung aso. Then pagbalik may sunog, di ba? We don't want that. So nitrofurazone, I still find this used in a lot of small animal clinics because it's cheap. Again, it's cheap. It is one of those antimicrobials which are inhibited when exposed to organic matter. It has been found to have mutagenic and carcinogenic effects, so it is used cautionary for breeding animals. And for us, it is banned for use and also for food animals because the withdrawal period is quite long, right? Mupiristin, most common, Bactroban, Bactifree, whatever back you could actually see in mercury drug. Mupiristin is the active ingredient for that. Then what makes this so good, right? Even I have it, in my first aid kit here at home in the apartment. Lagi may Mupiristin. Lagi yan. Right? Number one, it is good, really good, right? For wounds infected with gram-positive organisms, which are the common microflora of the skin. Your staph aureus, the other staphs, all that. They're usually gram-positive on the skin, right? So, and also it has an effect against MRSA, right? Which actually makes some of the wounds that we manage quite hard to manage because they're not healing, because there's this persistent infection. And that's because it is methicillin resistant Staph aureus. And Mupiristin actually works for that. Um, Again, with the advent of antibiotic microbial resistance, some strains of Staph aureus have developed resistance to Mupiristin. So again, it is still an ongoing challenge for all medical practitioners, humans and veterinarians alike, right? It prevents, how does it affect the bacteria? It prevents cell wall and bacterial protein synthesis. Um, and since dahil nga sa resistance, it's usually just prescribed for 10 days. For small wounds, you usually, like when you see the epithelial layer already, I stop giving anything, any topical thing, dahil hindi na yon makakapasok sa wound. Meron ka ng epithelial layer eh. Kapag ang wound healing process nakadating na sa epithelial layer, okay? Nag-form na siya nung medyo manipis na film-like layer on top of the wound. Usually, anything that you put on top of it would not be absorbed. It will just evaporate or get wiped on some surface, right? So usually, you stop there na. However, Mupiristin, even as good as it is, would have its own limitations, inactive for most anaerobic bacteria, Mycobacteria, Chlamydia, Mycoplasma, fungi, and yeast. Aloe spray. Let's go now to another kind of preparation, right? Aloe spray. It contains aluminum powder, which is prepared in an aerosol type of preparation. And basically, what it does is it's not the aluminum that has a direct effect on the wound, but it basically acts as a bandage or a barrier, right? Which is common for a country like ours. The dirt, moisture, flies, microbes, especially for food animals or large animals, where hindi mo naman pwedeng what do you call this? Sawayin yung mga flies everywhere, especially when you're treating cows. When there's cow dung everywhere, horses, goats, when they are what do you call this? Um pastured, in a backyard setting. It's very hard. Nandiyan lagi ang flies. So you can use aloe spray for that. It is hydrophilic, so you can easily wash it off with warm soapy water. Sometimes some owners would uh, be scared kapag dumikit sa kanila yung aluminum, because kapag hinawakan mo yung patient dun sa area na yun, didikit sa'yo yung konting aluminum aloe spray. So you could just tell them, "Oh, just wash it off with warm soapy water." Right? All this. Yeah. Maybe place over ointments. Basically, hindi mo na kailangang mag-bandage. Yung takpan mo ng gauze and tape yung area if you have aloe spray. And again, it does not contain any antibiotics. So we're moving now from antimicrobials to another one. Right? This is an example of that. Example in a horse, lateral side of the horse. Sorry. Right here, wherein there's a drain. Okay? So you just protect it. Okay? Now, may nagtanong before. Before I forget, may nagtanong. Doc, we're managing open wounds, malaking laceration. Can I just spray aloe spray all over? No. All right. What do you call this? We don't really. By nature, by I don't know. It's an unspoken rule that we don't use it for like open wounds, because you have to. They call this. It's not that you have to let it breathe. That's not the exact reason. Let me think. Right? It's because those wounds were sorry, this spray is basically for those wounds that you oppose with primary intention and you just want an extra protective barrier. Your open wounds need a little more, they call this, more finesse than that. And the trajectory of your spray tends to cause microscopic soft tissue damage on an open wound, right? Like that. Sorry, there's a watermark. Right? So basically, this is an what do you call this? Two-third wound that you just put the aloe spray on top. Okay. Combinex. Combinex. Right. What is this for? Is this for the wound? No, it's to repel flies and other insects. Right. It's diclofenthion as the active ingredient. I think you have discussed this in parasitology, and it has a particular color which is violet or purple. The, no farm, I think, for my experience, all farms that I've been in always have Combinex. Right. They may not have suero, they may not have certain medical supplies sa kanila, but they always have Combinex, right? Yeah, mostly used in large and food animals wherein you expect to have myiasis and open wounds, maybe until a veterinarian comes in for consult. A lot of the caretakers and the ones directly taking care of the animals would immediately get the Combinex when they notice a wound until the veterinarian comes in, right? So like that. This is a botched castration. The basically the suture opened because you're supposed to suture here, right? Yeah, like here. You're supposed to suture kind of here. But this is a scrotal approach for castration, and then it opened, which is expected for a scrotal approach, right? Especially if you're not removing the scrotum. Okay, this is use of Combinex on a pig, right? And sometimes, honestly, Combinex, sabi nila, ginagamit din siya as identification marker. Since it's color purple, mas madali daw. And sadly, I don't know if you noticed this already, if you've been exposed to it in swine prod and all that. Um, we know that ear notching is a type of identification process for them, but sometimes they would just get the, call this, yung pang-ahit, the blade, and they would mark the skin of the animals. See this one? Yeah. And you actually see that a lot in slaughterhouses. You know, they're numbered 1, 2, 3, 4, 102. O kaya may code or something. And because they don't have the hot iron na pinipress, they don't, I don't know, they don't practice the ear notching. They kinakaskasan nila yung minamarkahan nila yung pigs with a blade, which is so disheartening to see. But then again, I repeat, these are not veterinarians who are doing it. These are basically the caretakers who are, those backyard pig farmers who wala naman sila, na hindi naman sila tinitingnan ng vet, you know. Yun yung mga yung mga inahin na nasa likod lang ng bahay, yung mga ganun. So let's go. Aloe vera gel. It has been found to have antibacterial effect against Pseudomonas aeruginosa with this, and also an effect on the wound, stimulatory effects on cell proliferation and migration of fibroblasts and keratinocytes, which helps during the repair phase. It has, anti-prostaglandin and anti-thromboxane properties. I don't know if the girls, even the guys, I don't blame you. Naging uso to eh. Diba? The aloe vera gel, you buy it from somewhere, like Watson's, I guess. I don't know. Then you put it in the fridge, you let it cool, and then you put it in your face, and it's so refreshing. Lalo na ngayon, tag-init, diba? So, they say, it's good. Yeah, that's why it has a soothing sensation. And if you go into literature, aloe vera actually has this active ingredient, kumbaga, right? This compound, which is acemannan. And acemannan has more literature than aloe vera itself. Acemannan is acetylated mannan from isolated from the aloe vera plant. And this has been isolated from the aloe vera to prepare certain like higher concentrations of the acemannan for wounds, right? You have the hydrogels, you have the freeze-dried gel wherein you just put it on top of the wound, right? It's very much indicated for burns because you want to rely on the soothing sensation because burns are really painful. Of course, lacerations, abrasions, and non-healing wounds. It has been found, acemannan, right? Not aloe vera, acemannan itself. It was found to stimulate macrophages to secrete certain cytokines, interleukin 1, tumor necrosis factor alpha, and it can bind to growth factors, right? It is hydrophilic, which helps cleanse the wound and reduce wound edema. And the optimal effect for this can be felt, can be observed after 7 days of application, right? And so a lot of those burn wounds that we uh, experience as well in surgery after that glove thing for heat sores, we also used aloe vera gel for that. Now, honey is has been, I think for years now, at least 10 years now, has been in the forefront of wound healing medications, right? What's in honey? Basically, it's a super saturated sugar solution that we know, manufactured by bees after they regurgitate and evaporate. Those are the processes for the production of honey. Okay. It has been found to have anti-inflammatory, antioxidant, and antibacterial effects. It increases collagen content, enhances the collagen maturation process. It also maintains the optimal pH conditions for wound healing. So this one, I've used a variety of preparations of honey, right? You could have the commercially available gauze patches. Just imagine a gauze, and then it's has honey in it, right? And also you have the ointment gel right there, the Medi honey. I've used this exact thing. We've For me, honestly, I've never used actual honey. Meron akong client, galing yung anak niya sa Baguio. Known for the honey, di ba? Makikita mo yung mga sa gilid, sa palengke, sa Baguio. Bili siya isang lapad ng honey. Dok, pwede ba namin gamitin 'to? Sabi ko, why not? Why not? It actually helped. It actually helped. So, I am not sure if how. They basically just use it as like a twice a day thing. Kapag nililinis, after nun nilalagyan ng honey, and then binabandage. That's it. So, ang sabi ko lang, ma'am, ingat pag nasa bahay, kasi yan ay matamis, yan ay either didilaan ng pasyente. We don't want their saliva on that wound because the oral cavity is so dirty. So, ayaw nating parang ma-entice yung pasyente na diladilaan yung wound niya. So, make sure it is covered, number one. Number two, it also attracts, if the patient is not in a cage, is not indoors, nasa labas lang, and then you use honey, for sure, puputaktihin yan ng mga langgam. Honestly. Right? So those things you just have to discuss with your patients, and you have to think of those factors when you prescribe such things, right? Basically, actually, honey, there's a series of thesis studies when I was doing my thesis as well, because my thesis was in honey and propolis. My co-advisee, basically, same kami ng advisor. Yung kanya, honey for wound healing, wherein we use mice and all that. Yung akin ay honey for stroke. So, nakita ko talaga na maganda yung wound healing niya. But yung kanya, ang gamit ay yung patches. Patches made by the National Institute of Health and UP something. A department in UP wherein they had to gamma radiate the gauze to make sure that it's sterile. Okay, lot basically. Now, wound cleansers. This at quite expensive, not quite expensive. For me, kasi medyo cheap akong doktor. Gusto ko yung mga mura lang ginagamit. But I had experience using this when I was working abroad, and basically, imbes na tubig lang or betadine or chlorhexidine yung gamitin mo, what we use is this Tris Edta. So it has Edta there, and it is in sterile water. What it does is that, based on literature, it increases permeability and susceptibility of gram-negative bacteria to the lysozymes, the antiseptics, and antibiotics. Wini-weaken niya yung defense mechanism ng bacteria. It also chelates and potentiates bacterial cell walls and destabilizes biofilms. So magandang siya ang una mong nilalagay during wound cleaning. Right? And it can also be combined with other antibiotics, and it has been found to have synergistic effects with the following antibiotics: oxytetracycline, penicillin, um, chloramphenicol. I think that's what I'm saying here. Um, polymyxin B, nalidixic acid, and gentamicin. Right? Now, that is it for wound medications. I'm just including bandaging complications, and I have attached another PDF which is supposed to be taught for surgery laboratory kung paano magkabit ng bandages. Like for example, you're putting a bandage on the neck, on the chest, on the limbs, depending on the problem in the limbs. What I'm going to discuss right here would be ano yung mga complications that we usually see and we want to prevent when we bandage certain parts of the animal. Okay, so let's begin. So when we say external coaptation, you will continually hear this: small animal surgery, large animal surgery, external coaptation. This is the use of casts, bandages, splints, hobbles, or slings to stabilize either fractures, luxations, or displacements for limbs, certain other parts of musculoskeletal system, to reduce post-operative swelling, and to manage and protect the wounds. So it's not just there for bone problems, right? This is also what we the term for those bandages that we use for wounds, right? Now, when we choose a certain external coaptation technique, this is affected, or this depends on a variety of factors, right? You have the patient selection. What is fit for this patient? Is it a big dog? Is it a cat? Is it a small dog? Is it a big cat? Patient prep. You have to make sure that before you cover that wound is clean and well debrided. Usually, the use of external coaptation techniques would require sedation and anesthesia, especially for skeletal problems. The appearance of the cast and bandage, the use of donut bandages, which I'll discuss in a bit, I think. Basically, donut. Imagine your tuwalya. Okay, tuwalya, panligo. Yeah. Bilutin mo siya. Like, parang tinitwist mo siya na pag nagpipiga ka na, pag naglalaba ka, then pipigaan mo. Okay? Twist it all the way and then join the two ends together. You have a donut bandage. Now, where do we use this? Ang laki ng bilog. Ang laki ng bilog. But also, makapal. So what do we usually use donut bandages for? Number one, when a patient, old patient would have bed sores, na nakikita mo na yung oscoxae niya, right? You don't want that, and the patient cannot move on their own. So you have to flip them like every 3 to 4 hours. So para ma-prevent yung wound from being in contact the whole time to the bedding of the patient, you usually put a donut bandage around the oscoxae para naka-raise siya and para mag-heal yung wound, right? Stirrups are a certain bandaging technique that we use for, imagine kapag na-dislocate yung shoulder mo. You have the stirrup, diba? May nakatali around that area. Okay? You also have to take into consideration the limb angle. Is it a varus or a valgus angle? Is this leg normally displaced or normally gearing towards the lateral or the medial side? Right? And toe cover and monitoring is very crucial for limb bandages. Right? These are the common problems. Either it's too tight, okay, too loose, pressure sores, not enough length or coverage was covered by the bandage. You immediately lose mobility of certain joints, which you do not need to immobilize. Abrasions due to bandaging and wet bandages. Let's discuss each one. Too tight, right? Ito actually most common tong, it is one of the most common complications. Why? Because you want your bandage to be secure, right? You want your bandage na hindi matanggal ng aso kahit makulit na siya. Gusto mo na nandun siya for a while, especially if the patient is just coming to you, like for example, every other day for bandage checks or for replacement of bandage. So you want it to remain there, especially if the patient is going home for a while. So madalas ang complication, you see such pressure source. Okay? Remember, this part of the limb of the patient is flexed. This one is in contact with this. So when this bandage is too tight, this will cause, we call this, these wounds there and here, right? And also, bandages that are placed too tight, right? Those places wherein dapat may curve, yung normal curve appearance ng leg, usually that will be compromised as well. Okay? Kita niyo siya. And I said vascular compromise. Because when you place your, imagine a limb, like a forelimb, you place the bandage too tight on the radio-ulnar area and the carpo-metacarpo joint, right? You would see that the distal part na hindi na na-cover ng bandage would have limited vascular supply because you're squeezing it in. Imagine yung kung nagpapa-BP ka and it never let go. You know? Kapag bini-BP ka and then ini-inflate yung cuff, 'di ba? Sikip-sikip sa arm, and then there would be a certain point of that blood pressure taking na parang hindi mo na maramdaman yung yung distal part ng arm mo. That happens to our animals as well. So you could experience this vascular compromise. Nawawalan ng supply. And also, kapag nawala ng supply ng blood pababa, yung fluid na nagfo-form, because you have the capillaries here, you have the lymph drainage as well being compressed. So the lymph fluid would accumulate in here, kaya yan nagsaswell. Right? Now we have a way to prevent that. I'll discuss this in a bit. Okay? Also, peripheral nerve compression. Usually, sa swero pa lang. I'm not a fan of covering the swero, the entire thing. Like, maglalagay ka ng swero dito, kakavera mo ng tape, kakavera mo ng cotton, kakavera mo pa ng vet wrap, right? You wouldn't know. You don't know if your IV catheter is still intact until nagli-leak na yung fluid out of the thick bandage. And if your bandage is so thick as well, okay, adding to the two-tied bandage, it will take a while. Your patient needs fluids, right? Pero hindi mo alam na hindi na pala pasok yung IV catheter mo. And you only realized it nung basang-basa na yung bandage. So, since I'm always, what do you call this? Mas gusto ko kasi lagi nag-work sa emergency part ng medicine. I don't like internal med. I don't like a specialized, one organ lang yung gusto kong i-treat. I'm more of gusto ko emergency. We always rely on how intact the IV catheter is rather than a bandage. So I don't really use the bandage unless I'm very, what do you call this? I know the patient will bite it and all that. But this is one complication of too tight bandages. When you see, kapag matagal na this is a cat licking that area. Kapag matagal nakaswero yung pasyente mo, and you bandaged it because it's clinic, clinic regulation, you usually bandage it. After nun, hindi makalakad ng maayos ang aso or pusa. That is a very common complication. Sabihin mo sa owner, ma'am, it's just because of the IV, medyo painful. You're gonna BS your way through it, but it could be prevented. It could be prevented. Kaya hindi siya masyado makalakad. Nagkakaroon ng decreased function on that limb because the peripheral nerves were compressed for quite a while. Okay, see the difference? This is the normal limb, and this is the limb which was put, may IV na nakalagay dito. So, ayan, lumaki. Okay, this is also an example of that. Right? And always, please, when you put IV, shave it. Please. even if you have to tell the owner, I have to shave it, it's a clinic regulation, this is SOP, kahit away-awayin kayo niyan. Nakipag-away na rin ako sa owner dahil ayaw niya ipa-shave yung paa ng Pomeranian niya na very well groomed pero malnourished naman. Kailangan ko yung IV, I need to shave it. If you don't want me to shave it, go to another vet. That's me. I don't mind losing a client who can't follow, my way of taking care of their animals. When you reach that point, magiging ano na rin kayo doon, magiging confident na rin kayo and quite hard on clients who don't follow your medical advice. You could find another vet. It's fine. Go ahead. I'm not here for the money. Okay, 2 loose bandages. Reverse naman natin yung spectrum. We'll go to the other end. Maluwang. Of course, it could easily get removed from the limb that it needs to cover. It could slide up and down the limb, which could cause irritation and pain to your patient. And also, the cast, ito yung matigas na naka-form sa paa or sa kamay, right? When you need prolonged immobilization, right? This is a cast. It should be done after any limb swelling, if present, has subsided, usually after 24 to 48 hours. Hindi mo agad yan ikakast, especially if the injury just happened. Okay? Why? Because when a swollen limb shrinks to its normal, yung bandage mo, na akala mo sakto lang yung tightness, ngayon maluwang na. Okay? So that's why you have to let it subside for a while. Now, this is what you call a Robert Jones bandage. This is attached in the other, like the post-operative, what do they call that? The post-operative thing, bandages or something. Post-operative wound management. I think that's what I called that PowerPoint, right? This is a Robert Jones bandage. So when you apply it, this is a vet wrap. This is an adhesive bandage. You have to what do you call this? Create a certain tension. Okay? Kailangan binabanat mo yan, pero dapat hindi siya maging too compressed. Okay? Pressure sores, very common. Even if very common with bandaging complication, and even with for older dogs who can't move on their own anymore, right? They could be happening mostly on body prominences, which is the olecranon, calcaneus, accessory carpal pad, right here, right? Dahil dun niya naka-flex. Okay? Now, this is how we prevent it. Okay? Usually, and they don't do it after say, okay? When you put your bandages in, usually your bandages would be a layer of cotton padding and then wrapped by the vet wrap, which is quite water resistant na kahit mabasa siya, hindi siya agad talagang puro nababasa. It will repel it for a while. Okay? Now, what you have to do when you are bandaging the distal limb, both forelimb and hind limb, all right? You have to cover, okay? You have to cover up to the level of digits 3 and 4. Okay? Hindi na pala makita dito yung isang digit. Ano sa kabila? Okay? Digits 3 and 4. Why? Okay? Kapag dito nag-cut, wait, I'll try to, never mind. I hope you see the mouse. Kapag dito mo tinigil yung bandage mo, right? You would have that vascular compromise occurring here. Okay? The blood flow to here is compromised, and the blood drainage, the lymph drainage, is compromised as well. So mag-accumulate yan dyan. Lalaki tong area na to, like what you see here. As compared to placing the bandage up to that level, na makikita mo na lang is yung 3 and 4 toes, pads and nails. Okay? Not the digits, the pads and the nails. Okay? You could prevent that swelling. And of course, the peripheral nerve compression, vascular compromise, and hypothermia. Right? So that is the rule for me. Right? You could do it this way and then watch after 2 days dahil sa Pinas, hindi naman pinapalitan ng IV until kailangan. But actually, ang IV, pinapalitan yan ideally every 3 days, chine-check twice a day, especially if it's wrapped so snugly underneath this bandage. So, ang one disadvantage niyan, ang pasyente mo hindi makalakad. But then again, if your patient, number one, has a fractured leg, you don't want it walking around. If your patient has an IV, you don't want it walking around so much because it can dislodge the IV. Number three, if your patient is so sick that it needs IV, then it shouldn't be walking. Right? Yeah. So that's why that's also one of the things why I'm not a fan of the vet wrap thing. Um, I like it. I see the advantages of it. And I use it still sometimes, especially if alam kong ang pasyente ko ay aggressive, nangangagat, kinakagat ang swero. What else? Yung gustong naliligo sa water bowl. Hindi pong kakawkawin niya. I don't know if that's the term. Kakawkawin niya yung water bowl, eh di basa na yung IV mo. So the bandage has its advantages as well. It would depend again on your patient. So again, remember when you place your bandages, even bandages for IV catheters, place it up to that level. Okay? Right. Oh, this is the explanation, right? The metacarpal tarsophalangeal joint right here, or your metacarpals would hit the phalanges, the proximal phalanx. That is the common area of swelling and necrosis because usually you think that's where you should end it, but no, right? Now, loss of joint mobility and range of motion is very common for long duration immobilizations of limbs, right? Number one, because they're not using the leg, the muscles would experience disuse atrophy because they're not getting used, liliit yan, right? It only applies for muscles, guys. All right. Pathological fractures right here as well. Okay. Yan yung common na nangyayari if it's a prolonged bandaging. So if you are gearing into an orthopedic specialization, you have to know, okay, and determine how long is enough. All right. If you need to change the bandages, you have to change it regularly. Okay. And even for patients who experienced fractures, right, dislocations, we call this displacements, luxations ng mga joint, shoulder joint, elbow joint, femoral joint, rarely, rarely. What do you call this? They need to have a certain level of exercise for that while the bone is healing. Right? We'll go into this in fracture management when you go into surgery too. Yeah, hindi yun pwedeng nakatigil lang. That's why even with us, for example, you broke your hand, you broke your ankle, kailangan mo pa ring maglakad dahan-dahan so that your muscles know that it's still in use and that your bones are still in use, right? Now, this is the usual. This is for literature. If you are placing a cast on a young animal, you usually change it for every 2 weeks. This is cast padding ha. Ito yung binabasa na matigas na kailangan mo ng lagare para tanggalin. Right? This is every 2 weeks. For adults, since their bones heal slower than young animals, it could be as long as 4 weeks. But then again, it would depend. All right. If you think you need to change it, you need to see the leg, you're suspecting something happening underneath that cast, then remove it. Right? You are not bound by the schedule that I'm giving you. Right? Slings daily. Okay, the slings that we place on for like shoulder luxations, hip luxations, that is frequently frequently changed. Strictly daily daw, because you want to make sure that the way that you immobilize the way that you replaced the head, for example, shoulder, the way that you replace the humeral head back into the scapular acetabulum is still there. Okay, so you want to make sure that the joint is still properly anatomically aligned. Right? Now, again, if your patient is showing discomfort or you're suspecting any injury, you're suspecting sores underneath there, you're seeing signs of compression, ischemia, hypothermia, kapag medyo malamig na, yung po, diba? Huwag mo nang hintayin yon. Remove the bandage. Okay? And check. Right? Abrasions very common when happening. Basically, there is increased friction between the skin and your bandage. So you want to prevent these. Right? Yan. All right. This is not the same dog. It's just a common thing. All right. Doc, hanggang dulo, sinara niya. Okay? That's why I use this picture. Hanggang dulo, sinara niya. Why? This dog has a distal fracture, right? What do you mean a distal? It's a distal radio ulnar, nasa baba, and there's also a fracture on the metacarpal. That's why you needed to immobilize the whole distal limb, right? And that's why you have a hole there so that you could still check, right? Yung nangyayari dun sa tips ng 3 and 4 digits mo. Wet bandage. Now, this could be externally caused, rain, water bowl, urine. Some of the owners would want to lead their patients to call this na, Doc, pwede ko ba ilakad yung aso ko? Hawak-hawak niya yung swero, meron siyang leash, happy-happy si doggy. And then, pumunta dun sa partner, parking lot na medyo basa. Pagbalik, basa ang bandage. Replace. Right? Internal causes naman. Urine is, sorry, back to external causes. Urine is also very common. Hian, especially if the bandage is on the hind limb, very common. A water bowl, yung mga gustong magkaukaw ng tubig. And also internal causes. So what could cause the bandage to get wet internally? The production and secretion of wound exudates, pressure sores, which will become a wound, which will produce their own wound exudates, and skin damage as well. So you have to watch out for strike through, I've discussed this, and odor production. Now, kapag ang pasyente ay nasa ward, nasama-sama ang amoy, I always, when I graduated and when I started my first work, okay, I was in shock. Kasi ibang-iba pag nagtuturo, pag inaaral mo pa lang, tapos nandun ka na sa clinic or sa hospital, ibang-iba. You know, you have to physically examine your patients daily. Right? I know we're working through, ang dami mong ibibigay na gamot, ang dami mong papalitan na bandage, but you have to, you know, you don't want, number one, you don't want your clients to see it before you do. Number two, you want to address any problems as early as you can before any infection or any complications would start appearing and would make management harder for you and the animal. Okay? And again, our patients don't speak. Hindi yan nagsasabi, Doc, makatin na yung bandage ko. Doc, masakit yung kamay ko. You don't see that, but you see signs of it. So you have to be very observant. Okay? Not just in small animals, but also in large animals. In large animals lang, mas malaki sila. You just approach this na mas malaki sila. At mas dumi yung area for like bovines. For horses naman, alaga yan kasi talaga. Ang horses ay alaga. Okay? And they're usually cleaner. They would need hay. Ang problema mo sa horses usually would be flies. Okay? But if the place is good, if their waste management is really good, rarely a problem. Right? So what we do, minsan yung owner na gustong ilakad ng pasyente, what we usually do, we cover the bandage with plastic wrap. Yeah, the cling wrap, yeah, we do that. Or we cover it with another bandage. Just for that time. Okay? Sorry. This is for, again, 2019. As you can see, I'm not scaring you. I'm reusing my PDF from last year, so forgive me. But basically, that is the coverage of the second lecture exam, module 7, 8, and 9. Thank you for one of you to that reminded me. Thank you for that. Yeah, I've been tardy as well. You know, when I said focus on yourself, I have been focusing on myself so much. So forgive me for that. Yeah, this is capping the second lecture exam coverage, which will be I will be uploading it by Monday. And it will be available again for a week, right? Yung syllabus ko, tinapon ko na. Yung course guide, whatever, student guide, tinapon ko na yan. And hindi ko na siya fina-follow dahil, I don't know, it's just kind of strange to be strict with schedule and with ganitong dami lang yung hours na pwede nyong i-take, you know. But I hope, you know, it's already take home basically. And still some of you would answer the exam 30 minutes to the deadline. You know, if I give you a week and then you still like submit, you know, beyond that, medyo stretch na siya, di ba? So just, you know, work hard when you can and focus on yourself always. When you can. All right. That is it for Module 9. Thank you for listening. And if you have any questions, follow up, you know, inquiries, just let me know. You can send me an email or send me a PM directly. And I will answer as fast as I can. All right. Thank you guys. Stay healthy. Send my regards to your family. Thank you. Have a good day.